What diseases can be treated with a high-intensity focused ultrasound?
Well, there are quite a few at the moment, and some of them very successfully, some less successfully, and there are other ones that are in development. So I think the most common one is uterine fibroids in ladies, and that interestingly has been approved in the United States by the FDA, Food and Drug Administration, and extensively in China and the Far East, many thousands of people treated there, and increasingly now in Europe. That's not a cancer. In terms of cancer, we've treated liver cancers and kidney cancers partly successfully, more successfully with some of the livers than the kidneys, and there are reasons why it doesn't always work for kidneys. For example, the ribs get in the way, the fat around the kidney sometimes gets in the way, and we're looking at ways to overcome that. In China, they've used it for bone cancers, although they've done it with radiotherapy and chemotherapy. And sometimes there's a bit of a combination then, you're not quite sure how effective the one is as opposed to the other. Prostate cancer it's being used for, and that actually is being used quite extensively in Europe, slightly different machine to the one that we're using. And pancreatic cancer, and nowadays there are new ways people are starting to be able to get an ultrasound beam in through the skull to treat brain tumours. That's very early, but I think over the next few years that will improve and develop.
That's massive. Why is it only just coming to the UK after being used in the Far East and the USA?
Yeah, well, I think in the USA it's just really being used for uterine fibroids at the moment, and it's a machine which is guided by MRI, magnetic resonance imaging. The Chinese machine that we have is guided by ultrasound as well as so you use the diagnostic ultrasound to see what's going on and the high intensity focused ultrasound to treat. I think the reason why it's been slow to come across here is because of the lack of good clinical trials. So we had the first machine from China in the Western world in 2002, and we're doing trials on kidney and liver. And the result of our trials got it CE marked, certification in Europe marked, and now there are probably 20 or 30 machines around Europe. We still, interestingly, have the only one in the UK at the moment from China, although there's one or two others coming in. But I think it's the strict regulations that you need in this country to do it on the basis of good clinical trials, which is why it's been slow in this country.
Well, cancer treatment is quite important and lots of people's interest. Will we ever cure cancer?
Well, we can cure some cancers, and I think the thing about cancer is that the term cancer covers a huge range of different things. So I'm a urological surgeon and look after kidney cancers, many of which can be cured by surgery. Prostate cancer, some can be cured by surgery, but a lot of people have prostate cancer and actually live with it and die of something completely different. Testicular cancer has been a huge success story because probably 50 years ago 50% of people died, but now virtually everybody is cured of testicular cancer. Not quite all, but even if the testicular cancer has spread to the lungs and other places, many of those people can still be cured by the chemotherapy that's used. So a lot of cancer can be cured, and I think that as there's more research and development and more understanding of it, more of them will be cured.
Do you have any advice for young people who are thinking of a career in medical research?
Well, I would encourage people to have a career in medical research. I have some colleagues who say that they would not encourage their children to become doctors or to be involved in medical research. I think that's very sad because I want some good doctors to look after me when I'm old and falling to pieces. And in terms of medical research, I think a lot of medical research is hugely exciting, especially in good places. I mean, obviously Oxford has a fantastic reputation for medical research, and lots of things have come out of Oxford and indeed many other places as well. So I think what I would encourage young people to do if they want to do medical research is to find somebody who's good to supervise them, somebody who's got a good track record. Or the person that I was brought to Oxford by Professor Peter Morris, who was world renowned in transplantation, and owe him a lot. And so yes, you need good people who've got a good track record, and then I would encourage people to do it. Very exciting. I mean, a lot of medical research happens in a sense by mistake. Some things happen because you're looking for other things and you suddenly notice it. But I think, you know, an inquiring mind, somebody that asks why and doesn't just accept what's happening, and that's important.
Well, the more medical doctors we have, the less patients we may have.
Yes.
So you can focus on preventive medicine. Can you tell us a bit about your research into Norman Heatley and his unsung role in the development of penicillin?
So Norman Heatley is a fascinating person who I knew very well. He died in 2004.
Oh, in person?
Yes.
Oh, right.
He died in 2004. He lived in Old Marsden in Oxford, which is near where we used to live. But he was a young researcher who did his PhD in Cambridge. He wasn't a doctor, he was a biochemist. And then in Cambridge he was working with a chap called Chain, who came across to Oxford, worked with Professor Howard Florey in the Dunn School in Oxford, and brought Heatley across. And Heatley was the young man who was responsible for doing a lot of the basic work on penicillin. And the problem with penicillin, Alexander Fleming is reputed to have been that discovered it, although in fact there were people beforehand who might have used it and discovered it. But the problem was that it was very difficult to purify. And Norman Heatley was very clever at firstly making lots of very minute, tiny scientific instruments, but also had the ideas of how you might purify it. And he was responsible, under Professor Howard Florey, of actually producing penicillin. And then they did the first trials in Oxford at the Radcliffe Infirmary in 1941. So his is an amazing story. It was Florey and Chain and Fleming who got the Nobel Prize for penicillin, but a Regius Professor of Medicine in Oxford called Henry Harris said, without Fleming, no Florey and Chain, without Florey, no Chain, without Chain, no Heatley, and without Heatley, no penicillin.
My final question, obviously you have a very, very, very busy life, and today thank you very much for making a journey from John Radcliffe Hospital to Balliol College. In your busy life, how do you switch off?
I switch off by, I have 4 wonderful children, a wife who's very supportive, and I go running, I go swimming, I go skiing, I go fishing. I spend time with the children and the grandchildren. We're involved in a local church and various other community activities, so I have lots of things to switch off from medicine with.
That sounds great. Thank you very much for being with us.
It's a pleasure.
Voices from Oxford.